to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good evening. I am Gail Demore, Madam Chair, and with me are board members Dr. Ed Weiner, Andrea Sheehan, and Dr. Marwa El Sahabi. In addition to our professional staff is alongside us, we have Susan Luminello, Director of Public Health, Michael Green, Associate Director of Public Health, Christine Mathis, our Environmental Engineer, and Marlene Johnson, RS Health Agent. And online, we have our recording secretary.
Not online, but she's going to be taking.
She'll be taking minutes from the
Yes.
recording. Okay, and that's Miss Julie Falkingham. So thank you all for the work that you do. Please note we are live on and taped by BCAT and are available for appropriate comments and questions through this technology. Thank you to BCAT for all that you do and what you do for this community, which is keeping us all so well informed. The first thing on our agenda is the approval of the May 27th minutes. Does anyone have any questions about the minutes or comments?
Ms. Chair, I
Yes.
make a motion that we approve the June 4th, 2025 minutes.
Second.
Great, all in favor?
Aye.
Aye. So, great. Hi. So moving on to citizens' time. Is there anyone here in our audience or online in our audience that is not part of the agenda but would like to speak to the Board of Health? No one's online? And you're both on the agenda?
Well, I got an abutters letter about an application for,
So you're on our agenda?
Yes.
Perfect.
so yes.
Great, thank you. We'll move on to our chairman's report. Although the calendar date of June 21st sets the official start of summer, the weather sure has indicated that the start of summer is here and in full force. With that said, I just wanted to remind residents to stay hydrated, take breaks from being outside and in the sun by seeking shade or other activities inside, as well as checking on family members and friends, neighbors, or pets who may need assistance with this extreme heat. It is important to build our community by helping one another. Moving on to subcommittee reports. Technically, we don't really have a subcommittee report, but I did want to make a quick announcement here and propose a quick discussion in regards to the fact that at our last meeting, I had announced, without discussion amongst others on the board, a newly established informational Board of Health Subcommittee updates in public health. I should have at least offered up a discussion amongst all of us here before deeming that it was done. And I would like to offer my apologies to my fellow board members for just announcing the subcommittee has been established without discussion amongst all of us. I want to be working within a formal yet cohesive and collaborative way and feel that that particular move did not promote what I stand for. I would like to rectify that tonight by adding a discussion regarding the updates in public health subcommittee to tonight's subcommittee agenda area. So I open this up for discussion and turn it over to Marwa for an introductory summary on the subcommittee.
Yes, thank you, Madam Chair.
Do you want this too?
It's okay, so I was, I think part of what we were thinking of, Dr. Weiner and I, is to really have more of a discussion during the Board of Health meetings that involves like a health component. We talk a lot about, obviously, issues that are affecting the community in terms of buildings and regulations and environment. And we were looking to kind of involve more in terms of public health and health safety and maybe issues with chronic disease. And obviously, like as a physician, I'm not going to be giving medical advice directed towards specific people here, and that's not the intention, because I don't want to be held accountable for, that they're not my patients that I'm speaking to. So I think the idea was just to give very, very broad advice to people, when to seek help from your physician, what to be aware of. And in all honesty, it may be nice to involve everyone in the board, and this is open for discussion, so I'm just kind of throwing ideas out there, where we could even do, like, on a rotational basis, have each member of the board just take a few minutes and talk about something very specific. So, like, I could talk about chronic disease, Dr. Weiner may tackle something else that, is of particular interest. Someone could talk more about environmental, hazards related to public health. There's so mental well-being. There's so many things, nutrition, that, really, I think, can be addressed by the Board of Health. So I just wanted to kind of open that up and see if that's of interest to other members.
Thank you for explaining that a little more thoroughly than I did, and I did want to give people an opportunity to comment or ask questions and go forward with this idea.
Thank you Gail, for bringing it for a discussion, and Mara for explaining the little bit of the content and the agenda items. So my question is, are we utilizing the staff? Like, we have subject matter experts that are paid staff on the Board of Health, and part of the coalition that the town is paying for, and subject matter experts
Absolutely.
that work
Yeah.
for the Board of Health. So are we utilizing the staff?
So I don't think we've gotten to the point where we've even, like, talked about that. This is just an idea that, I'm bringing up today. But I do think part of what we could do is, obviously involve Susan and our nurse, who's amazing and always sets up so many informational, stands at the Board of Health, right? We could work with her and kind of, in a way that we could address her issues a little bit more broadly during our meetings, and give a chance to people to hear things that may not actually step physically into the Board of Health. So that's a way that we could also utilize, our specialists. So.
Ms. Chair, our staff have their own reports that they can speak to whatever they'd like to and bring up what they'd like to. I think that as responsible elected public health officials, that if we have some interesting direction, generic direction for the community, that it's our role to go ahead and do that. Personally, I attend at least two. We have met last week, 2 weeks ago, at a grand round at Lighting Clinic. And there's so many absolutely new issues that the public has no idea, that have just been discovered, new research. And where else can get this information? Nowhere. But since we are sitting in there and taking notes, this would be a perfect forum for elected public health officials to put out the information for them to speak to their physicians and their health professionals about it. So it's just an opportunity. If the board feels that this is worthwhile, I know that people in the community have asked me about certain things. I know they've asked all of us about certain things. This is an opportunity for us to do real public health awareness. We do it at a health fair. Our professionals have their own agenda item every week.
I'd like to understand what the coalition, we got a grant for $1 million. We've hired people that are going between Wilmington, Lexington, and Burlington. They're working on a regular weekly schedule. What public health issues are they discussing? What are they bringing to the table for the communities they're serving? Is that something that would fit this type of forum?
So, one of the things that I have asked all the staff members of the coalition to begin doing for the month of June for next fiscal year is to do a monthly report that will be submitted to the board for the directors in Lexington and Wilmington. Whether they want to give it to their boards, that's up to them, but it will be going to this board at a regular meeting. So that way you can see what it is that they're working on, and then you can ask me any questions like you would any other staff member about what they're doing. It doesn't really, like, their work wouldn't fit into a subcommittee, because the subcommittees a subcommittee is a smaller portion of the board. So usually a subcommittee would be not a quorum, so 2 members of the board doing some research or attending a meeting, whatever, and then reporting back to the board. So Tri-Town Coalition staff, although I think that is, important, and that's why I want to start those reports from them, would not fit into this subcommittee format.
See, I kind of disagree, because it's not so much that I need to know, it's the community that we're trying to, like, I'm happy that you attend these things, and it'd be great information for me to hear, but it's really the audience that we're pitching this to. So much for the subcommittee, that's not really what I think Maura and Ed were suggesting. They were saying that they would bring the information and, give a 5-minute update at this meeting, not just to us, it's to everybody. And so I'm saying, if these people are doing public health work on behalf of the people in the town, either they should come to this meeting and present, or we should understand what we're presenting to the public so that they know this is happening on such and such a date, or this is something that they've been working on. Because those are the things, I mean, it's great to educate us, but really, if you want to, like, really bring the dynamics to the community, that's the audience that we're addressing.
I have a
I
question.
don't disagree that, if you want them as an agenda item, I can put them on as a agenda item, ask them to come to these meetings or call into these meetings and give a presentation to the board on whatever it is that they're working on. However, that's separate. That's like the staff doing a presentation, like Marlene's presentation tonight on food variances. That's something that she's working on. A subcommittee is a subcommittee of the 5-member elected board. So there's a difference between the staff and the board.
Well, don't staff participate in the subcommittees, like
If
any
you
other
want,
subcommittee? That's what we're saying.
If you wanted to have a subcommittee on the coalition, you could create one tonight, and then you could have 2 board members meet with the staff of the coalition. You could do that.
Are you suggesting to make it more formalized?
Well, I'm just saying, I don't think the information should just come from 2 people. If we decide that this is some form that we want to use to bring public awareness, then we have people doing this work in
Utilize our
addition.
staff and the board.
Yeah.
As we do with every other subcommittee.
I mean, I'm not an expert in medical field. That's not my background. So, they have their background warrants to this. And so I'm just saying, what are we trying to accomplish? I'm not so much concerned that there's a subcommittee that was formed and it just got formed, but they have a medical background. They attend these sessions, and what they learn is being shared with not just us, but the town of Burlington.
Well, it's for the public.
Well, I also
well, that's
feel
what I
like
say.
this is maybe a stepping stone to growing into something that you're suggesting, but just for starting, it was the idea of they're gaining knowledge that would be valuable to the public, and by sharing that in this format, in this forum, they would be able to reach more residents by sharing what they're learning. But we could certainly continue the discussion and also look at building it, but I think for a stepping stone starting stepper, we could start with a topic and have them bring it to the table and then build from there to see how it goes.
I mean, also, I think, I'm sorry.
No, that's-
We can wait and see what the next report looks like from the coalition, and see what type of topics they are involved in, such as tobacco, right, lots of things, right? I mean, they're involved in a lot in the community, and then see how we can build on that, or how we can supplement that, if that's something.
Yeah, I mean, I don't know, like, you could say that at any point, like, you could, once we get the report, you could say that during the report. You could say, we'd like so-and-so to come in and talk more about this or whatever in the report. But if you wanted to have a subcommittee for that, like, say you wanted to have a subcommittee on tobacco or something, right? Then you could have a meeting, would post it, and the staff could attend, whether that's our staff or coalition staff or whoever. You can ask our staff to attend your subcommittee meetings. Generally, a subcommittee meeting is like, we have staff requested from you. So like, if we have an application that's coming forward that might be complex, we want a couple of board members to come so that they can, at least the board members kind of get to see it ahead of time and then report back on it to the board so that it'll ease the discussion during this meeting. So that's generally how we ask for a subcommittee, but of course, the board itself can form any subcommittees they want.
So are you looking for a motion?
Do we need to vote on
And
this?
could you
or-
just share with me, like, some of the recent ones that you went to? Like the topics that you were involved
Well,
with?
the first topic that I was going to bring up is some very generic issues, which come across my desk, is a publication of when to go to the hospital. Especially heart attacks, women present totally different than men for myocardial infarction. And I have put together, and I was going to do it maybe tonight or the next, just some basic information in the public, published material that's been out there and now filtering through what men should do if they have certain symptoms, what women should do. Should you wait and see your doctor? Should you just call 911? Very basic. In addition, we just went to a program on GLP-1s. 1 in 8 Americans are on GLP-1s now. And what are they? Everybody's talking about them. I saw at least 25 commercials in the last day on GLP-1s. Just define it. Go talk to your doctor about it. It's basic information to go to speak to your doctor that you may be able to get the same topics, couple bullet points by watching the Super Bowl. But the bottom line is we do have a following, and I think that it was something I can do. Now that I'm not chairman, I don't have to put together all of the background material I had to do. I've been thinking about doing this for a long time. And now that we have a chairman and a vice chairman, very capable people, I do have time. We do have a eminent nephrologist on our board now. Why not give 5 minutes of meeting on just real public health? Sometimes we don't do real public health here other than land use and regulations and whatever. This would be something of pure public health per meeting. And you're welcome to join us. You're welcome to do it. I just thought that I would do the first one. Dr. Maurer said she would do a second one. Maybe you want to do a third one of something you've heard. I just think that for many people who tune in, they don't see real, pure public health. And I thought that could be a responsibility. It is innately on our board. Look, I don't need to. It's a lot of work. But I just thought I'd put it out for a vote to see what the board does. If they don't, that's okay, too. But it's just something that I have had an interest in doing for many years.
And to be honest, I kind of jumped the gun on this, so to speak, because I thought it was a great idea, but it wasn't fair to do that without discussing.
Yeah.
So that's why we're back.
Yeah, I'm not
So
saying it's
this
not a good idea.
Yeah,
I'm not saying
and I
I'm not
agree,
saying that
but
at
I
all, but I'm
also-
saying I want to bring it.
Be more mindful of how
Yes.
we approach it and how we do it,
Yeah.
which I understand, and
Plus,
maybe we
we
could.
also have this grant, and we have people behind the scenes doing a lot of things that, in fairness, like, I know they have only been on board for a while, but, it would be nice to get an update to see
Right.
what we're sharing with the other communities, and are those the same types of issues that maybe people in our community aren't aware of, but they are in the community happening? So
Exactly.
I just want to expand it. I see nothing wrong
And
with the
actually, it might
topic.
expand more as
As
either
it
Mike or
grows.
Susan could, when they do education.
Susan, is there anybody on the coalition who is doing this type of work at all?
Well, what-
Well, I should hope so.
No,
No.
there's no doctors.
No, what I'm saying is, we have a tobacco person who's doing tobacco. We have go through the list. There is nobody doing real,
What do you-
even our
Well,
epidemiologists.
Yeah, I was just going to say.
What is the question?
That's what I was going to say. We don't have a medical professional on the coalition?
Maurer's our medical director.
On the coalition?
on the coalition?
No,
we have a nurse.
No, we don't
Who
have a
helps?
Yeah,
medical
that's what-
no, we have a epidemiologist, a health community.
Okay, well, that's a medical professional. I didn't say
Yeah,
doctor.
but
No, they're not medical, they're data,
statisticians.
public health data.
Well,
Who's that?
It's public.
Katie Fashawn.
Oh, okay. I
Okay.
just didn't recognize
And
when you were
then
saying that.
we have a nurse, they're all part-time. We have a shared services coordinator who's an admin. We have a health communication specialist, which she does like
Okay.
the website.
I was using, when you used, I was saying medical professionals, they're in the medical field.
The nurse, I'd say the nurse.
Okay.
But also, there's topics that are not necessarily
Okay.
medical that might be beneficial to the residents, and I think it's a broad umbrella
Yeah.
of
Oh, I
different
thought
things.
this is geared more towards
No,
medical.
I'm just talking like from my perspective, just because that's what I do, right? So I can talk a lot about chronic disease or things like that, but then there's environmental pollutants, there's, there's mental well-being, there's nutrition, there's the importance of physical exercise, there's, so many things, like, from environmental health to mental health to physical health to, so tracking of diseases, so it's like a whole scope, and that's why I think as many people involved as possible is nice. And having these regular reports, I think will be great, because then if there's anything we want to expand upon, like even when, I think last year, you had brought up like wanting to know more about mosquitoes and like, tracking, how do we track them, how do we efficiently get rid of disease that is spread by mosquitoes, something like that, if it comes at, through a report, we can expand on, and maybe someone can talk about that and safety regarding mosquitoes, for instance, when it's applicable in the summertime, tick bites in the fall, but like certain things like that, I think is helpful, even AI with respect to the health field, because I have a lot of patients, I'll just throw it out there, a lot of people come and they say, I read this on, Google search, or my chat GPT told me this, but again, things like that, it's important to really speak to a health professional, right? So, there's just so many aspects that I think as a Board of Health we can address, that's all. Interesting.
So I'd like to make a motion that we establish an updates in public health subcommittee. I think that's it. I think you, as written and presented to, and you presented to us tonight with the description here. So I move that we do that.
Do we need to vote?
That's up to you,
We'll have a motion on the floor.
I'll second it, because I think it's a good idea, and I like the idea of it, and if it's not going the way that we think we can discuss and revisit it.
I don't think it's chairman.
Oh, I can't second things, sorry.
I'll second.
Second.
So that was a motion made by Dr. Weiner, seconded by Mara Sabab. I'm mispronouncing. Sabahi, okay. I was worried I was mispronouncing it.
It's okay.
Okay. So we're good with that?
No? Can we vote?
Oh, I need all in favor?
Aye.
Aye. Sorry. That was unanimous, thank you.
Thank you.
All right, so now we're moving on to our agenda items. The first thing I have is a permit, keeping of animals, hens at 11 Chestnut Ave. Is that person here?
That person doesn't seem to be here, however, his abutter is here.
Okay.
I don't know if you want to hear
I
the
don't know,
abutter.
what do we do in this situation? I've never not had someone here.
you can either,
Hold it?
you can continue it to the next meeting, you can discuss it and then continue it, you can vote on it.
Do we get any, is there a reason that he's not here to get stuck in traffic?
Do you
Was
know?
there any communication?
No idea. I sent an email out about the detour.
Okay, let's talk to the abutter.
Should we talk to the abutter? Because
I would.
you did
Yeah.
do your due diligence in being here.
Yeah.
Would you like to come up and sign in and just state that you're here as an abutter?
Thank you. My name is Stephen Vaccaro. I live at 1 Dennis Drive. And
Did you say
thank the board
Vaccaro?
for listening to me. Pardon me?
Did you say Ficara?
Vaccaro.
Could you please-
V-A-C-C-A-R-O.
Could you please sign in, please? Print your name. Thank you.
And you're here as an abutter
Correct, yes.
to 11 Chestnut Ave?
Yes, I live-
Regarding the chickens?
Yes, I live directly behind them.
Okay.
And my problem is, and I thank the board for taking the time to hear me, my problem is I have a very extensive pool area, and I've spent a lot of money on my backyard, and This thing is literally 53 feet from my pool area. Now, I know it's within the setbacks for the side ordinances and zoning and everything, but I believe this, I haven't seen the plot plan. I went on your site and tried to come up with, there's supposed to be a plot plan according to your rules and regulations. They should have submitted a plot plan.
Is that public knowledge, though?
Yeah.
You should have it right in your...
Well, we have it.
Yeah,
But would
if
he
you
have
pull
it?
up,
I can
No.
pull it up, I can, is it?
I didn't know if it was, if it would be
yes,
listed in the
it's in
agenda
there.
online
If
or...
you pull up
It
the,
is on the agenda, and we as a board have the information I think you're asking to see,
Yeah.
It's public information.
Okay, so this is what,
but it wasn't published
property
yet.
sketch.
Doesn't make
here.
any difference.
I don't know if you
As
can
long
see
as
that.
it's
See if
put
I
in
can make it
papers.
bigger.
Community.
So, where
Are
is
we
your
looking at the property
So I'm
sketch?
Here?
I'm just north of that.
So here. Oh, this one here? So it's 16-186.
Correct, that lot right there,
Okay.
yes.
So it's showing, there's the coop there. Let me see if I can make this a little bit bigger.
Are you B216?
I don't know where they're getting those dimensions, but
16,186.
I don't agree with those.
the
They got 170 feet.
inspector did verify the,
132 feet from my back door to the chicken coop.
From your back, 132 feet.
And
From
it's
your
50
back door to the chicken coop.
Correct.
Are you the property to the left, I'm sorry? The 16,186?
16,186,
Okay.
Yeah.
we call it north.
So you're disputing the 170 feet?
Yeah. I have a plot plan of my own lot, and
Is that because,
I've
Well,
done,
what are
and I went out and
the
measured
setbacks?
myself with a laser measurer. And I've calculated this thing to be 53 feet from my pool. Now,
so your pool's in this open area?
correct.
Is this, what is this building here next to the house?
I would say that's probably my pool, but it's not a very good, oh, that's my deck. That's probably the deck. I have a deck out back.
Oh,
Patio?
That's the deck, and then there's a pool south of that.
What's between your property and the other property? Is it a fence? Is it just bushes? Is it, I'm just trying to get a
It
sense.
just rolls off.
Oh, it just rolls right onto the...
My lot's a little higher than his. And then there's a fence for my pool, but it's only a chain link fence.
I see.
And then there's some space.
So it's pretty open in other...
It's open. You can see
So
see
your
right in.
pool's fenced, but not your property, and you're
Correct.
worried about the chickens
Correct.
getting too close to the pool?
Right, it's only 53 feet, and I know I'm going to smell this thing. And, you know, you made a very great observation about the weather and the heat and everything, and perfect, because you know what it will do.
I have people in my neighborhood that have chickens, and I don't smell them, so I don't know, I don't want to dispute or get into an argument, but
Yeah.
I think it would just depend on the number of
Well,
chickens.
what is the number, too? I don't see anything in your regulations that stipulate.
no more than 6.
Pardon me?
No more than 6.
There's no more than 6 allowed.
Right.
I saw a lot of, now again, I navigated your site as best I could, but I noticed that most of the time you were only allowing 3.
so there's no more than 6 allowed without a
Without-
special permit
right,
from the
they-
planning board?
Because there is
So
no
we
limit.
can allow
There
up
is-
to 6.
There is no limit.
Oh.
From
For
the
the
Board of
board,
Health.
right,
Board.
I see.
Thank you.
right. But they'd have to go
They'd
to
have
the
to come
planning
in.
board if it's more
Right.
Yeah,
than 6.
except the coop is sized for a certain number
Okay.
of chickens. What, do we know how many chickens? it is?
I don't have that in front of me, no.
Mr. Chairman, is it possible that we could forward the, since the proponent is not here, could we forward the 11 Chestnut Hill plan? Because they have to fill out a complete plan, sir. What they're going to do with everything, how...
Well, yes, they need manure management plans,
They've done
feed
that.
storage.
Yes.
Yeah.
I have one here, but I'm not sure it's complete.
If you give me your email,
Yeah, I mean, that's all well and good, but and I'm not opposed to them having them, but I just don't understand why this thing couldn't be situated in a more central location in their yard than being pushed up against me. Again, doing my measurements, this thing's closer to my back door than it is their own.
Well, there was an inspection done, correct?
Right, so the regulations that we enforce is that the coop can't be less than 15 feet from each property line.
Property line.
Yes,
Okay.
that's the coop to the property.
No, and then that's a zoning regulation.
Correct, it
But
is.
again, this isn't just a building that's going to, a shed that's going to be, just sitting there. This thing is going to be housing animals that create waste and smell and attract other rodents and everything. And it's been pushed up against my lot more than anywhere else on the lot. I just think it could be centered, or relocated
Have you
centrally on the
spoken
lot.
directly to your neighbor regarding this?
Pardon me?
Have you spoken to the neighbor regarding this?
No, I didn't.
Okay.
No, I did not.
They may not be aware of your concerns because they're not here, unfortunately.
Well, I would have thought they would come to me, that if they're the ones who were doing the erecting and looking for this, they should have come and talked to me, I think. I mean, I know they're new, they just bought the house within the last year or so.
So they moved in, bought the house, and then I didn't even get to hear Marlene's summary
Sorry.
of the incident or the property and all of that because we waited.
Right, so they contacted our office and they inquired about what they needed to bring chickens to their property. So they were shown the regulations and they built the coop. The inspector went out and inspected the coop, made sure that it met the regulations, Board of Health regulations. Would you give me your email? so
Yeah.
I can-
Can we postpone
Yeah,
this?
I
Because
think
feel-
we
I feel
should
like if
post-
everybody else has to come and they've been invited, and if they haven't called to say they're sick,
Right.
I mean, I feel like we should just pause the vote.
Postpone it. Postpone until they're here.
Okay. Do I have to make a motion to do that? Okay. I'd
So
like-
I need a motion to postpone, to continue this matter.
Motion to
To the next
continue
meeting.
this matter to the next meeting.
Now, this plot plan is not, it's certified, correct? Looks like it's just something they drew up.
Yeah, it is.
Couldn't they be required to support with a certified plot plan? I mean,
They,
because this,
If you think that, but if you think,
I have a plot plan, okay? I have a certified plot plan of my lot, and I've taken these dimensions on here and gone out and located that, and it's a big difference from what they're telling you it is.
then you should bring that up with Marlene.
So I think they should become with a certified plot plan to prove me wrong.
So what are you saying the distance is from you're saying the distance from your pool to the property line is how many feet?
From my pool to the property line is 18 feet,
Only, okay, so 18?
and then it's 35 more feet to the coop. So that makes it a total of 53 feet from my pool area.
They only have to be in 15 feet from the property lines.
I understand that. But because this, again, this isn't just a shed that's going to sit there. This is going to be housing domestic animals. It's going to create waste. It's going to have smell. It's going to have rodents. And it's being pushed into the corner of my yard with a backyard that I use extensively, entertain and whatever.
Well, I was just thinking maybe the 15 was off because they don't have an accurate property line.
No, I'm pretty sure they're within the zoning setbacks. That isn't the problem. I just feel that it's being, it states here that the Board of Health may impose conditions and safeguards and other limitations. So why can't you tell them that they need to locate this thing more central in the yard so that it's not, the
If they're
burden is all
following
on
the
me?
guidelines, we can't exactly place it for them.
Well, where does that leave me? I mean, again,
we can make a suggestion or recommendation.
We can
but
make suggestions,
Yes,
but we can't
But
You can put a condition
Let's
on the
postpone
permit
this.
if you wanted to.
Yeah,
to move it.
Or you can put a condition on any permit.
we can do it now.
sure, it says it right here in your own bylaws.
But I guess what my question to you would be,
Can we do a
what
site
would be
visit?
an appropriate amount of feet? 20 feet, 30 feet, 40,
Centrally
I
located,
understand
centrally
your
located in the yard.
Visit before the next,
I think we
can we
could.
do that?
So it's no closer to me than a butter on the other side or a butter behind.
So in fairness, you'd like it to
In fairness to
be
me,
spread out to everyone.
centrally located within
That's
their
what you're looking
property, so it's basically the same amount from everybody, instead of being
Marlene,
pushed over
could that
onto my
be
end.
moved, you think?
Is that something that can be moved?
It's already erected. I don't know.
Well,
We'll
I
have
mean,
to
again,
find
I
out. I
mean-
wish he was here, because then, you know,
It might go a little smoother or
Yes,
different
maybe he
things.
would
Because if
agree
you
to
hear
just
about,
move it.
Yeah.
there are certain protocols in regards to waste management and keeping up with the coops and things like that, and their coop will be inspected. And the other thing is, again, it's already erected where it is, and if
Oh.
you're finding that there's problems with it, your right as an abutter
that's
is to file a claim and go on.
As far as it being erected,
Contact Marlene.
I mean, that's a weak excuse, because people, there are companies out there that move structures, so.
I understand your concern, but again, the person who is looking to do this and get the permit is not even here, and I appreciate you being here as a concerned abutter, but I think we also have to do our due diligence and do a site visit, as mentioned, take a look at and be able to talk to the
That's fine.
owners
Anytime you want to
as
come over,
well.
you're welcome
And
to
you're
come by.
invited to come back to the next meeting as well.
Yeah.
As an abutter, because the other neighbors were, notified as well, and unfortunately, you're the only person who showed in addition to the owners. So,
Because it's all pretty far from them, because it's all pushed on me.
right, but I also understand your concerns, and I think you have a right to speak up for that and ask for certain
And
things.
not for nothing, but I've grown up in this town, born and raised in this town, when it was a rural town, where they really did have
And
chickens
things
and
are
stuff. So I know what it smells like, okay? I grew up.
But that was before management of animals.
Yes and no,
Place.
but it's still, you have to be on top of it at the same time.
I understand. I
So, you
understand
know.
your concerns. So you're welcome to join us at our next meeting. Before the next meeting, we'll do a site visit, which
Yeah.
means we'll all go look at it. Again, we have an expert who did work with the owners on this application, as well as someone inspected it. And as far as the regulations,
Yeah.
It
And I-
passed inspection.
I question that plot plan, because it is a little out of whack.
Just one question, Ms. Chair. Did the animal control officer, does he, or it was a she, does she get involved in this at all?
she gets involved, but that's more the animals.
That's more than the animal?
Correct, yes,
Okay.
yes.
Would it be appropriate that she be invited to this next meeting?
Susan?
I mean, we can certainly invite her. I'm sure she'd be willing to come, maybe she can give some information on the best management practices of the
You know, that,
animals.
we approve it with the animal control officer for the police department,
No, that's for kennels, not for,
just for kennels.
Not
But she did inspect this.
I don't know if she inspected this.
No, she,
No, she did
no,
not.
because they don't have the
I just
chickens
said-
yet,
I missed-
so.
That was the question that I was
Yeah,
asking.
usually it's the kennels we do in tandem.
thank
So unfortunately, due to a lack of information.
Yeah.
But still wanting to, work with you and your concerns, we're continuing this matter until our July meeting.
We did vote on that.
Yeah.
I thought we
I
just
did, I
did.
made a
We just
motion and
did
somebody
that.
seconded.
Did we vote?
We did a motion.
We didn't vote, we didn't, I know
We
what you're
didn't
saying,
vote.
Ed,
We
no.
didn't.
We made a motion, we.
So all in favor for continuing this to our
To
July
our next
meeting?
meeting.
And the next meeting is July 22nd.
Okay. Make note of that.
Mr. Chairman,
You.
can I just a point of clarification? So where did you want the site visit to be? At his property and this property?
I think it's worthwhile. We're going to have to look at both
We'll have to
properties.
post that as a meeting of the Board of Health.
Okay.
Okay?
And we'll all
Get
go.
times, when everybody can come.
Okay.
Yeah, no problem.
Thank you.
And then we'll be in touch to let you know
Yeah.
what would be a good time, and then we'll have to get in touch with the owner of the other property as well to get a good time, so.
Thank you.
Okay.
Good. Thank you very much. I appreciate your time.
Thank you.
I just want to make sure I'm reading it right.
Susan, can I ask a quick question? Are the chickens allowed to just free roam?
No, in our regulations, it says they cannot.
They cannot.
Yeah, unless it's fenced.
Right,
and they can
there's no
come up.
fen-
It
yeah.
doesn't appear that this is
Right.
fenced, so they would not be able to free
It would not be
roam.
allowed.
Yeah.
Although they're running all over Mill Street this week.
Okay, thank you.
That's every day.
Yeah, yeah.
Okay. Okay, so we're going to move on to our variances. We have two of them. The first one is your rest.
Your rest. That person's not here. I would recommend that you continue it.
So I need a motion.
I move that we continue.
He's your rest.
Oh, I'm sorry.
I was thinking Pokey Works.
So you're with your rest?
Sorry.
Okay, perfect. So you're 8 Vandergraff Drive. Please come on up to the table, sign in, and introduce yourself. I apologize for that. It's been kind of great.
He's waiting so patiently, too.
I feel like I'm in middle school still. What is going on?
Chickens to the end.
Whoa.
Okay, so
Okay.
Mr. Hawkins is before you this evening. He is the Corporate Food Service Director for the Urest, which is a food service provider at 8 Vandergraff Drive. And just a background on unattended food establishments. So an unattended food establishment is an operation typically located in office buildings or restricted break areas where access by the general public is somewhat restricted. These operations frequently offer packaged, time, temperature control for safety foods, and also non-time temperature control for safety foods products that are displayed via refrigeration units, food racks, basket, and/or countertop display units. Unattended food establishments may also be equipped with microwave ovens or other automatically dispensed hot and cold beverages. The one common characteristic of these operations is that they lack the presence of an on-site person in charge, because these usually operate off hours, grab and go. So the variance request is that the representative would like to receive Board of Health approval for a variance from 105 CMR 590.003, which is Food Code Chapter 2, 101.11, which requires a person in charge be present at the food establishment during all hours of operation. As far as the same level of protection, the Massachusetts Department of Public Health, the Food Protection Program, provides a guidance document for unattended food establishments. It was prepared by the Conference for Food Protection. This document was provided to the food establishment noted above to establish a written food safety plan for the unattended food establishment. You have a copy in your paperwork of that. I have reviewed and approved their written plan. And by following their procedures outlined in their plan, the same level of protection can be achieved. So action by the Board of Health. The board may vote yes to approve the unattended food establishment variance for Urest at 8 Vandergraff Drive with the following conditions. This food establishment shall follow their approved written plan for minimum requirements for an unattended food establishment. This variance is for the location noted above. Any additional proposed unattended food establishments within the town of Burlington will require a separate written plan and variance. Violations of this variance may result in an appearance before the Board of Health and may result in a temporary suspension of the food permit. Continued violations may result in a revocation of the variance by the Board of Health. In the event of an imminent or threat of a health hazard, the Board of Health may suspend the food permit without prior hearing as outlined in 105 CMR 590.014A. The food establishment manager shall notify Board of Health within 24 hours if there was an imminent health hazard, food tampering, and/or food injury. 6, the last one is the Board of Health may revoke, modify, or suspend this variance if, in its opinion, the level of protection is not equivalent to that provided with the strict application of 105 CMR 590, which is the minimum sanitation standards for food establishments. Or the board may vote no, not to approve the variance.
Anyone have any questions?
I do not, I think it's pretty standard.
I thought it was pretty thorough. Are there any questions?
Yes, I just have one. I'm sure it's an oversight, but there's a sheet called emergency notification.
Yeah.
And listed is Jared Hawkins, it's you?
Yep.
And Don Van Ness. I think under that, would you add for this application, the Burlington Board of Health and our phone number?
Yeah.
Same thing I do for the
But
the
that's one of the
biotech.
conditions.
But this is going to be listed.
Oh,
This is going
okay.
to be
Yep.
placed in there. So I just add the Burlington Board of Health would be 781
Yeah.
270 1955. And that would,
Perfect.
and that would be the only, and I have no.
That would help solidify the
Solidify
conditions.
because this is going to be written somewhere. So
Thank you.
I have I have nothing else.
So I need a motion to approve the variance for Eurorest at 8 Vandergraaf Drive, unattended food establishment, along with the 6 conditions listed.
So moved.
Second.
So that was a motion made by Mary Beth, or Vice Chair Mary Beth Welch, and second by Andrea Sheehan. All in favor?
Aye.
Aye.
Awesome.
Great.
Thank you.
Thank
Thank you,
you.
everybody.
Wish you well.
You as well.
And our second variance is Pokeworks, 110 Burlington Mall Road, external grease inceptor. Are you with Pokework?
No, I'm trying to for the like animal raising.
11 Chestnut Ave.
So you were, I'm sorry to say that you were the first person on our agenda, and we voted to continue to the next meeting on July 22nd.
Don't tell them why. I'll think about it.
I'm sorry.
And we had to vote on that mainly because one of your neighbors, we had an abutter show, and you were not here. So we spoke with the abutter, and then we voted on continuing to talk more about this matter next meeting.
And the site visit, you might want, the site.
We are looking at doing a site visit. The abutter had questions about where your coop actually was placed on the property, and his pool, he has concerns about his property. So we agreed to come and do a site visit.
Are you okay with that?
So we can notify you when the site visit will be happening, and you'll have notification of our next meeting on July 22nd. Sorry.
Can I just,
Yes.
so the concerns were moving the coop.
Yep.
He wanted to know if that was a possibility, if you could do that. Are you able to move your coop? If
No,
that,
the coop is part of the set of my shed. Is this is not portable.
Okay.
the
I think
coop
we
is
need to
part of
see
your
it.
shed?
Yeah.
I think we need to see it.
No, okay.
It's pretty more than 30 feet away from the neighbor. There is a trees line between there. So it's the only thing I would say, there have a pool probably close to the border. My lot is bigger. They built the pool along my border line. So my consider the chicken coop is far away, more than 30 feet, than from their pool. Because from my border line, more than 30 feet, when Samantha visit, I showed her, the distance pretty far away. And I told her, I put a run, just go directly to all the not to their side, or that side. So anyway, it's fine, if you want it next month.
I'm sorry, we do have to, we voted on that, so I think we have to go by that.
Yeah.
To hear both sides and look at it ourselves, and we're all going to look,
Yeah.
just to do the due diligence. I'm sorry.
You were very late, I'm sorry.
No, I'm not sorry. It's, hard. But
So Susan, you'll be in touch with him
So we'll
too,
be in touch with you.
for the site visit?
For the site visit.
Yeah, someone's going to need to arrange the site visit.
Yeah.
With you and in your property, we can go to his property
We're going to look at the other
first,
property also.
And then we would post it for the neighbor's property, probably at different times, maybe then we would move over to the next property.
Okay.
that's fine. Good.
Okay, I'm sorry, I'm sorry.
Sorry. Yes.
We'll need from the board members too, what the best time is.
within the next, hopefully, 2 weeks to schedule this.
Okay, we can work that out. So the next
Our next board meeting
variance,
is in a month.
July 22nd.
Right.
So apparently he's not here, so
So
my
the,
recommendation is continue it.
so I need a
move we continue
motion.
Polk Warwick 110 Burlington Mall Road, exterior.
Second.
All in favor?
Aye.
Aye. Great. So we're moving on to discussions, food variances and HACCP plans by Marlene Johnson.
All right. Okay, so food variances and HACCP plans. So what is a food
Thank you.
variance? I know. What is a food variance? So the food code's definition is it's a written document issued by the regulatory authority that authorizes a modification or waiver of one or more requirements of the food code if, in the opinion of the regulatory authority, a health hazard or nuisance will not result from the modification or waiver. So we just had one today with UREST. So the food code requires that there be a person in charge during all hours of operation. So the variance is allowing them to operate without that person in charge. So there's a good example of a variance. And then a HACCP plan. What is a HACCP plan? Just a quick history on HACCP. So HACCP was actually developed in the late 1950s to ensure food safety for astronauts during space missions. So that's how old it is. So we've been using it for a long time. The definition in the food code is it's a written document that delineates the formal procedures for following the hazard analysis and critical control point principles developed by the National Advisory Committee on Microbiological Criteria for Foods for Service. So HACCP is a systematic approach to the identification, evaluation, and control of food safety hazards based on the following 7 principles. So I know the board is very familiar with the acidification with the sushi, so I'm going to use that as an example. So a HACCP plan for acidification, the first principle, conduct a hazardous analysis. So usually they start with the flow of food. So we're looking at the temperature control for safety item, which is rice. So rice is, when it's cooked, it's required to be held hot or cold. When they use it for sushi, they need it to be at room temperature because they take it and they roll that with the raw fish. You can't do it when it's hot. You can't do it when it's cold. So the hazard is that we're taking a temperature control for safety food and we're taking it out of temperature control, wanting to leave it at room temperature. So the principle 2, we need to determine the critical control points. So the critical control point of the sushi rice is pH. When they make their sushi rice, they're adding vinegar. So vinegar is acidic, so it's adding acidity, and it's lowering the pH, and it's able to lower that pH to a level where bacteria cannot grow. Principle 3 is to establish the critical limits. So the Conference for Food Protection has scientifically established that for us. So the critical limit for the sushi rice is that the pH has to be below 4.2. Principle 4, establish monitoring procedures. So we monitor the pH by testing it with a calibrated pH meter for every batch. Principle 5, establish corrective actions. So if the person who tests the pH finds that the pH is 4.5, their HACCP plan is going to outline what the corrective action is. Maybe it's human error, so maybe that's the first step, retest. If they still get something that's above 4.2 and above, maybe the other corrective action now is to add more vinegar, stir it, retest it. And if it still doesn't meet it, maybe their corrective action will say, throw it away. Principle 6, establish verification procedures. This is to ensure that the plan is working, the plan is being followed. The person in charge of the food establishment with the HACCP plan, they're checking the logs on a regular basis. They check their HACCP plan annually to make sure if there are any changes, maybe they change the pH meter and they need to update that HACCP plan, that they do that and that they let the Board of Health know. Principle 7 is establish record-keeping and documentation procedures. So all of the above, the flow diagram, the logs, the calibration logs, the corrective actions, those are all record-keeping documents. So food variances requiring a HACCP plan. So these are common variances that you've seen before. The acidification of sushi rice, which is the preparation of sushi. You've also seen the reduced oxygen packaging, ROP, also known as cook chill. Cook chill is cooked foods that are, foods are cooked, then they're packaged, then they're cooled, they're stored cold, and reheated when they're needed. So their HACCP plan is going to touch on a lot of things. They're going to be logging the cook temperature. They're going to be logging the cooling. They're going to be logging the storage inside the cold holding. They're going to be logging the temperature that it was reheated to. Some less common variances. We do have one in town, fermentation of yogurt. We have an Indian restaurant that makes their own yogurt. But other fermentation is some restaurants, not here in Burlington, but some restaurants make their own sauerkraut. Kombucha, which is a beverage, a fermented beverage. There's also smoking when it's used to prolong shelf life, not for flavor enhancement and curing. Right now, Burlington does not have either smoking or curing establishments doing either of those. Inspector training and protocols. So on the right-hand side, a regulator's guide, validation and verification of HACCP plans in retail food establishments. That's a guide that was developed for local boards of health by a food consultant. So this is what we look at when we are doing any kind of a HACCP plan. It lists all the different processes that are out there, and we use it as a guide. In addition to, I know I've taken at least 3 different trainings over the 25 years or so that I've been doing this kind of work. Samantha as well. So Massachusetts Department of Public Health Food Protection Program has had training courses on HACCP, and FDA also has courses. The protocol in the office is that the food establishment is required to hire a food consultant, and the food consultant prepares the HACCP plan. A HACCP plan is not an easy thing to put together. It really needs somebody who knows how to do that and has experience doing that. And then Board of Health staff reviews and approves the HACCP plans. When I get a HACCP plan, I really look at it with a fine-tooth comb. The last HACCP plan I looked at, I returned it twice because I found errors and some of the things didn't make sense. So I sent it back and said, you need to look at this. You need to fix this. You need to fix that. We also require that the consultant, the food consultant, train all the staff in the procedures of a HACCP plan. And then HACCP verification forms. What we do is anybody who has a HACCP plan, we actually put these together ourselves. It's a verification form. So, for example, you see acidification, and then on the right you see the cook chill or the ROP. So when we go in to do a routine inspection, we bring that with us if they have a HACCP plan. So this information is taken right out of their HACCP plan. It's right there in front of us. So we're looking at all of these, and if anything is out, we get them to correct it on site. We do mark it out on the inspection report. And there's an example of a couple of more. This one's the fermentation of the yogurt. And H Mart has a really unusual variance. They slaughter and eviscerate live aquatic animals. You remember that one, right?
Oh, I do.
Dr. Ed. So if you go into HMUT, they have the fish tanks.
Yeah.
The live
Oh, yeah.
fish.
Yeah, yeah.
So what they do is somebody says, I want an eel, or I want the tilapia. They pull it out, they slaughter it, they eviscerate it. So there's a whole procedure all around doing that. And so,
And on the dock?
Yeah.
But in the store.
Yeah, exactly.
But following this
Yeah,
plan.
exactly.
so we have our checklist that we make sure that they're following all of the procedures there. So, any questions?
When you mentioned the logs and doing all the paperwork, how long, is there a requirement of how long the logs have to be kept?
I usually tell them 30 days.
Oh, okay.
Because if there's going to be a problem, we'd want to look back for 30 days.
Okay.
So, yeah.
Interesting.
I have one question. When you were talking about the sushi, I just brought up, when you said that it can't be cold, what happens if they make it when it's cold? Is that cause
It falls
bacteria?
apart. So, yeah, the rice, so if
I knew that. I didn't know if it
Do
causes
you eat
bacteria.
sushi?
I
They-
do, but
Okay, so
only-
they have the seaweed, so they roll
Yeah.
that up. So if it's cold, the rice just kind of
okay.
separates. Yeah.
How to make
Okay.
sushi. Rolls.
I think it's interesting.
It is interesting.
Thank you.
You're welcome.
I just want to make comment. Ms. Johnson knows how uncomfortable I have been with HACCP plans and how many debates that she and I have had, although I have to give her a compliment. She has clearly turned me around because of her diligence in doing these HACCP plans, and I have tremendous confidence in her, and because of her, I can live with HACCP plans. So I just want to thank you, because, we've had our issues with HACCP plans in the past, and I am very confident now that if people do not follow the HACCP plan, you take care of it very quickly.
Right, we're on it like rice.
Wait on rice.
We're here too long. You're making jokes, Marlene?
Thank you for a wonderful presentation. It was very thoughtfully laid out and nicely done. All right, so we are moving on to staff reports. The first one we have is with Health Agent Marlene Johnson. If
Okay.
you want to give us a quick summary?
Sure.
Anyone have any questions?
So all the outdoor swimming pools have been inspected. All but one are open. One of the outdoor pools is having some issues that they're trying to sort out, so hopefully soon, because it's really hot out, so I would imagine people are dying to get in there. We have camps, so Samantha has started the inspection of camps and inspections. We have the mobile food establishments renewing their permits, the ones that want to come back into town. And any questions on my
I
report?
just have a question. Under inspections, pre-operation body art one,
Oh.
what is that?
Oh, sure, so body, thank you for noticing that. So there's a body art facility, they just pierced the ear. It's located in the mall. It's called Rowan.
Oh,
Yeah,
they
they
did.
came-
Chain.
They
all done by nurses.
All right.
The chain.
It's done by nurses, right?
Right.
Yeah.
Yes, so, yeah.
What a large
So
chain.
that's where that is.
Just when I saw the word body art, I don't think of that. I guess that
Yeah, I
is
don't-
body art, right? I've had body arts, those 12.
Well, I think because when they talked, it was up on this part of the ears.
Exactly.
It's not just
There's all,
ears.
yeah,
but it's
cartilage.
Yeah.
Exactly.
Okay, thank you for
You're welcome.
clarifying that.
Ms. Chairman, I have one quick question. What was the foreign object?
Oh,
I've been waiting. I was so curious. Do you know what it was?
I'm trying to remember. Oh, food made, oh, yes, okay, by the manufacturer. Actually, it was a piece of glass, and it was in baklava that was made in Greece
Wow.
and imported to the United States, and then from the United States went to the food establishment. So when it was brought to our attention, fortunately, the person had the picture of it, so I was able to forward that to the owner and his management team, and so they're following it up with their vendor, so,
Interesting.
yeah.
Thank you. Do we follow that up?
I did, by contacting them
No,
and
but
noting.
when he hears from the manufacturer.
We don't need to, yeah.
It's out of our hands.
Yeah.
So with that said, I need a motion to approve
So moved.
the health agent. All in favor?
Aye.
Perfect. Environmental engineer staff report, Christine Mathis.
Good evening.
Hi.
So I just wanted to highlight that the arbovirus monitoring has started this month, and that includes the trapping and testing of mosquitoes. Currently, there have been no EEE or West Nile virus positive mosquitoes found in Burlington or our surrounding towns. So Burlington is rated at the lowest category for each respective risk category.
Did we increase the number of traps we have in town this year or no?
No.
Are there any other questions?
Unattended pool. Do we have any jurisdiction on unattended pools? I guess it was unmaintained pools.
Yeah. So Eastern Middlesex Mosquito Control will provide free treatment to an unmaintained pool to stop it from being a magnet for mosquitoes. So they shock the pool, basically. So we just send a letter letting the owner of that property know that that's an available option.
But it's an option, so it's not mandatory.
Interesting.
Any other questions?
No, that's a good question.
That is a great question.
So there's nothing we can do if there's a mosquito pool, a large pool that's breeding mosquitoes, we have no jurisdiction whatsoever.
There's no regulations
Yeah.
on people's backyard pools.
Do you know why it's being unmaintained?
I don't,
They just don't do it.
Yeah.
just neglect it. I assume.
But if you
Okay,
don't want a
couldn't that
pool,
be
you
a-
can always
couldn't that be
drain
a
it.
nuisance?
Yeah.
I would
Couldn't-
think so.
If they're putting dunks in it, and, you know, if they're killing the larvae in it,
What if it's just laying there?
I mean, well, we don't know if they're doing that or not, like, they could say they put dunks in it and not, or they could, there was no way that's something that we would know what they were doing, like, we wouldn't be able to kind of prove that their pool is breeding mosquitoes.
Unless
They
there
may
was a
put
complaint.
Larvicide in it, but we don't know where the mosquitoes are coming from, you know,
Yeah.
so
Aren't the pools all inspected in town now?
semi-public.
Well, this is,
Not private pools.
Not
this is a private residence.
Not private
Yeah.
residence.
I won't run for election if you do that.
My pool's immaculate.
Marlene will kill,
What's that?
Marlene would kill us.
Yeah.
Well, we have there's no regulations.
I know.
I would have assumed, I don't know.
Yeah.
There would be regulations even for private pools,
No.
right?
No.
Like there are for chicken coops or for animals or
No.
for.
We have no regulations
Then you
for
gotta mow your lawn.
for maintaining private pools.
Yeah, private property.
Oh, I didn't.
There's a
You have to get
there's like a
permits to get the
safety
pool.
regulation for a fence.
Yeah, there might be
That's
some
different.
Like
building
safety.
codes around building,
Right.
you know, residential.
We
pools,
don't
but
have
I
any
don't know what they are.
regulation.
Yeah.
Correct. So was that, I didn't want to
I-
cut you
I
off
didn't
if
have
you
anything
weren't
else to
done
highlight.
reporting.
Yeah.
Did anyone have any other
I
questions?
just was curious, what does a potential environmental release mean at 176, one of the locations on your report, under investigations? Like, is that like a
Oh,
contaminant, like,
so we got a complaint that the complaint that we received was that there appeared to be a potential petroleum release
oh,
this is a commercial property, and I went out there and it was basically it was runoff from a puddle. There was no sheen, nothing, so
thank you.
I investigated and
It's
closed.
just the way it was written, I'm like, ooh.
I actually realized I have a question.
Yeah, this is really like,
What is a spray paint booth?
So, like,
Is that a tanning booth?
no, like for spray painting a car or auto parts.
okay.
Or in this case, it's
Okay.
for cabinetry.
Oh, okay. I was thinking like a tanning
No.
in someone's backyard or something. Okay.
This is
Thank you for.
commercial application of a paint booth.
Okay, so I need a motion to approve.
to approve.
Second.
All in favor?
Aye.
Great, thank you. So we're moving on to Associate Director of Public Health, Michael Green. Good evening.
Madam Chair. Yeah, I'd like to highlight tomorrow night, Wednesday, the 25th, we're going to have Advancing Healthcare Close to Home, a presentation put on by Skylight Health Research. They're going to be covering some basic questions about, what is clinical research and why it's important to get a good variety of people participating in clinical research. That's from 6 to 7 in the Murray Kelly Room at the Council on Aging, 61 Center Street.
Anyone have any questions?
Congratulations, that is really a fabulous topic. Hope, if anybody's watching, I urge you to go. I've been involved in that for 25, 30 years now, clinical trials, and I'm looking forward to going. So thank you very much.
Is this a spin-off from the mobile van at the health fair?
Good question.
It is actually not.
Okay.
But that company is also in contact with us, and we're looking at putting together like a panel discussion about clinical research and maybe a specific clinical research.
Oh, okay.
Specific.
I thought that van was cool.
Yeah, so we're looking at doing another one kind of similar, this being kind of the introductory one, and that one maybe being a little more in-depth.
Cool. Any other questions? So I need a motion to approve.
So moved.
Second.
Motion made by Mary Beth Welch and approved by Mara Sabahai.
Second by Marla.
Second by Mara, thank you. All in favor?
Aye.
And we're going on to the Director of Public Health, Susan Luminello, but also includes Associate Health Inspector Samantha Ellsworth
Yes.
and Supervisory Nurse Sandra Triani.
Yes. So, I don't know, well, right now, we're doing a lot of work on closing out last fiscal year, so we're looking at, our last fiscal year's budget and doing budgets for the new fiscal year for the grants that we have, and doing quarterly reports for that, and doing all the requirements, closing out the town's budget for the last fiscal year. Some of the things that the nurses have been working on, we've expanded blood pressure clinics to the Birchcrest. So they went over to Birchcrest, did a blood pressure clinic in, they call it the Tower. Over there, they have a room. And they also asked if we could come over and do another clinic in the other building, which is like across the street from that. If you're not familiar with that, that's the senior housing over there. So we're looking at doing that in the future. And then they asked the Tri-Town Coalition nurse if she could come over and do an informational thing to the residents there on medications, how there's some information about how to remember to take your medications, making sure, how that's important, and not mixing medications, and keeping lists of medications, that type of thing. So she's looking at doing that as well over there. They're also both been trained now, so our public health nurse and the shared services nurse as CPR instructors. So we're looking to look at expanding that a little bit more, and how we're going to do that within the region. That's one of the things that is in our work plan, so we're looking at that as well. So they've been busy with that. Do you have any other? One of the other things we were working on is the strategic plan for that. That's getting finalized for the coalition. That will be finalized now. I'll include that with my report next month. Any questions?
You added in,
Go ahead.
You added in your report 111 Middlesex Turnpike. I was sent pictures of tremendous flooding in that area, which I sent on to you, worse than ever. And where are we with that?
So Christine did go out and take a look at that in response to those pictures. However, the last time they were at the board, they still have an open nuisance letter with us, which goes back quite a few years now. You all know we've been working on this for a long time. The last meeting that they were at with the board, there was agreed that they were going to do all of these changes. They're doing a lot of construction out there, so they haven't completed that work yet. So once they complete that work and then we discover there is an issue, we wouldn't sign off on that nuisance letter. So hopefully they'll be able to complete the construction and there won't be any issues after the construction is completed. But I think, Christine, you could probably provide an update. I think she went out there and didn't see much water.
I copied you on the pictures I took 2 days after that complaint came in, and when I went, there were what I would call moderate-sized puddles, but not very deep, nothing like there had been in the past, particularly in that one area where we always used to see this, small pond. I think it was just honestly, just the amount of rain and the intensity with which it fell at that time. And again, as Susan pointed out, it's still under construction.
Excuse me, a member of the Conservation Commission sent me those pictures, and that's why I sent them on, and it was pretty bad.
Yeah, the pictures that you sent looked bad, but I went out that Monday, which was less than 48 hours after those pictures were forwarded to, sent in to you. And like I said, it was a couple of moderate-sized puddles, not very deep or anything. So it had, those pictures came in on a Saturday, so by Monday it had dissipated.
Any other questions? A motion to approve?
So moved?
Second.
Motion made by Vice Chair Mary Beth Welch and seconded by Dr. Weiner. And a motion, all in favor?
Aye.
Aye. And a motion to end the meeting.
So moved.
Second.
Motion made by Marwa El-Sahabi and seconded by Dr. Weiner. Good night. All in favor?
Aye.